So, where I left off at the last video was talking about the pharynx, the naso, oro, and laryngopharynx. And what I was saying was these make the pharynx structure is an open cavity, basically making your nose, your mouth, and your throat all one giant cavity. And that becomes kind of important when we start looking at how you swallow. How you swallow starts with first getting food in the mouth and then chewing it, obviously. Then you close your lips and the tongue works to make the bolus. And it's kind of this football-shaped packet of food that you have put into your oral cavity. The tongue then pushes up against the hard palate, making a seal, sealing that bolus in and pushing it. It kind of undulates up and pushes the bolus kind of in a wave-like motion back against the uvula, which is right here. The uvula triggers the epiglottis, which is the structure that covers the opening to the trachea. It causes it to fold down. And as it folds down, then the bolus is pushed into the oropharynx and then into the laryngopharynx and then on into the esophagus. The epiglottis is kind of horseshoe shaped and it covers the opening to the trachea. But as you age, the epiglottis actually reduces in size. It actually becomes narrower. And so it leaves more openings at the edge for some of that bolus to slip down into the trachea. So if you have grandparents or if you know of elderly people who have trouble swallowing or they cough up food a lot, it is because their epiglottis is now smaller and it's covering less of their trachea so that food can actually slip past and into their airway. This is one of those reasons that you have to make sure that you, if you are like working in a nursing home in the future, you really have to be careful about how the patients are actually eating. The esophagus will actually continue wave-like contractions to keep pushing that bolus down. And you can see that here. So it's opened up, the esophagus is opened up to allow this bolus to slip in. And then as it slides past, it closes again to prevent that bolus from coming back up. Now, esophagus versus trachea. I want you guys to be aware of how to tell the difference, especially when we get into dissection, the difference between the esophagus and the trachea. The esophagus is purely made of muscular tissue. This is smooth muscle, which is what makes up the alimentary canal, and it is often collapsed. When it's not being used to actually pass food to the stomach, it's not open, it's closed. The trachea, on the other hand, is the tube running to the lungs. So it is always open. It's held open by hyaline cartilage rings that you can actually feel. And it's held open because you are always breathing. You always need to be able to get air to your lungs. So you don't want that airway to ever collapse. So by having those cartilage rings, the trachea is constantly open. When the esophagus is swallowing something, it actually pushes the trachea forward, which if you've ever watched somebody eat, you can actually sometimes see the food passing through their esophagus. And then once the food is passed, the esophagus collapses again because it's not in use. So I love this picture because it shows you a little bit about the trachea and the esophagus. So you are actually looking from the posterior side. So basically what this picture has done is removed the trachea and the esophagus so that you're looking at the esophagus on top and the trachea on bottom. So you're looking from somebody's back. So you're basically looking through the spine here. So here's the esophagus, and you can see it's just a muscular tube. And that tube is going to collapse, and you can see the pharynx extending up here. Then, in contrast, you can see the trachea, which has these very definitive rings, and it has this connective tissue that holds it to the esophagus. But the trachea itself is actually a hard tube that is held constantly open. So, if you're keeping track, we've talked about the oral cavity and we've talked about the esophagus. The next videos will cover the stomach and all the things that happen inside the stomach. Make sure that you are aware of all the accessory organs that we discussed here, and of course how the esophagus is told apart from the trachea. Remember how a piece of food is swallowed? So that's kind of where I open the video. And I want to make sure that you understand those things as we move forward.